My name is Dr. Rachel Trinker, and I'm an audiologist and the head of audiology at Audien Hearing. First off, welcome back to the hearing world. This is going to be a process, and we're here to help you every step of the way. First off, here's a little bit about me. I've been dispensing hearing aids at a private practice in New York utilizing your insurance benefit, meaning getting my patients prescription hearing aids at the lowest cost that I possibly could. However, even utilizing insurance benefits, many patients are still leaving the office empty-handed because most of the time, treatment options are not fully covered by your insurance company, and the out-of-pocket costs can be thousands. I'm really excited to work with the patients at Audien Hearing because communication is so important and everyone needs to hear. So congratulations in taking the first step in your hearing health journey. I'll be here with you to help walk you through every step of the way. Selecting your hearing devices is not a one-size-fits-all process. Everyone is different. Some people go to the optometrist and get prescription glasses, and some people get readers at the pharmacy. Both options help you see and manage your day-to-day life better. If you're living with mild to moderate hearing loss and are over the age of 18, you have the chance to make the same choice with hearing aids. The best hearing aid for you is the one that you will actually wear. Getting hearing aids can be a process. You're spending money, and you are going to put in that time and effort needed to adjust to your new devices. There are certain factors to consider, like do you have arthritis or dexterity issues? Do you have a concern about your appearance? Is Bluetooth important to you? You need to think about your needs and what is most important to your lifestyle. So make sure the hearing aid is right for you. If not, we're here to make sure to take care of you and help you hear again regardless. That's why we have a 45-day risk-free trial period. We're here to take care of you no matter what, solve your issues, and find the best fit for you. Let's talk about having realistic expectations with your new devices. While this is an incredibly exciting step that can bring great change into your life, there are some realistic expectations that we have to consider. We cannot restore your hearing to what it was before you had a hearing loss. The devices are not a cure for hearing loss, but an aid. The devices may pick up background noise at times. It will need to be cleaned at times. There is technology living in your ears every single day. It is going to take time to get used to that and may take time understanding how it works. At minimum, it will take about 2 to 4 weeks to adjust to wearing new devices. During this first 2-week adjustment period, you will get used to the sound and get used to how they feel in your ears. I don't like to use the words good or bad, but the first 2 weeks may seem a little weird. This is normal for all hearing aid users. You may feel like you're hearing everything, including ambient noises or hearing an echo on your own voice or the voices of others. These are all normal challenges that new hearing aid users face. Give the devices a fair chance for at least 2 weeks before you form any opinions, because we know it's not going to seem normal at first. You're not used to listening through microphones. It's never going to be perfect, but if you notice that you're asking for less repetition, or the TV volume has gone down, or you notice that the birds are chirping in the morning, that means we're seeing improvement. Give yourself grace and know that we cannot expect perfection, but we're not striving for perfection. We're striving for improvement. Let's talk about adjusting to your new devices and the importance of consistent use. It's going to take a minimum of about 2 to 4 weeks to adjust to your new hearing devices. I want you to think about being in a coffee shop, right? You and I are having a conversation. You could tune out the forks clinking behind you, the waitress taking the order at the table next to you. You know how to focus on the conversation in front of you. But once you put these devices in your ears, you will notice everything. I call this the brain training game. Your brain needs to practice tuning out all of that background noise and focusing on the speech. Your brain doesn't know how to do that when listening through microphones. Many patients say that they only want the devices for the big holiday dinner, or their daughter's wedding, or some sort of super challenging listening environment. You do not know how to listen through microphones immediately. If you wear them without practicing for weeks, before this important social event that you have, you will not get the most out of the devices and you may not be completely satisfied with the experience. That is because you didn't give yourself enough time to relearn how to tune out all of that background noise, focus on the speaker, and overall adjust to the sound and the physical fit of the devices. I would never send you to just go run a marathon without practice. I'd send you to the track for some time, let you practice. Therefore, you could successfully run your marathon. Going to the track and practicing every day is the consistent use of using your hearing aids every day. But that holiday dinner or that wedding, that's your marathon. So again, wear your devices every day for a minimum of 2 weeks, several hours a day, and you'll find your new normal. Patients say in the first few days that they hear the floorboards squeak, the refrigerator humming, and I know all that can seem a little bothersome, but you need to relearn how to tune out these noises. So keep practicing. You got this. Let's talk about inserting and removing your devices. Try pulling up and back on your ears to get the device in as far as it can go. It could take time for this to feel natural. You may have to try different types of domes in your box or sizing up to get the most snug fit. It can feel like trial and error, and that is a part of the process. It's totally normal. I like to use the comparison of vision. It's like switching from glasses to contacts. The first few days or weeks, you may feel it on your eyes and may be very noticeable to you. You may have struggled to get them in and out of your eyes at first, maybe had to practice in front of a mirror. This is very similar. It may take some time to get used to the feeling of the devices in your ears, and you may have to practice insertion and removal in front of a mirror until it becomes natural to you. Once you are used to your devices, you'll be able to hear if they are in all the way. The sound quality will feel fuller when your ear canal is fully occluded by the device. Practice makes perfect. Be patient with yourself, and if you feel frustrated, just take a break and come back to it. Let's talk about listening breaks and avoiding frustration. If you need to take a break, then please take one. It's just like getting used to anything else in life. It takes time, so don't be so hard on yourself. It's normal not to feel completely comfortable or like an expert on day one. If you're frustrated getting the devices in and out of your ears, take a break and go back to it. Totally normal. If you need to take the devices out for an hour or so because you're feeling a little overstimulated by the sound, take a listening break. In the first few days or weeks, we want to avoid frustration. Avoiding frustration will help you have a smoother journey adjusting to your new devices. So, with time, you're gonna find your new normal. Just keep wearing them every day, several hours a day. You got this. Let's talk about your safety. Depending on the severity of your hearing loss, you may be missing certain sounds or hearing them at a reduced volume. For your safety, you need to hear if someone says watch out, or the beep of a dead smoke alarm, or the tea kettle whistling when it's done. What about your young grandkids yelling for help from down the hallway, or even as simple as someone knocking at your door? If you have a hearing loss, wearing your devices will help you hear your environment. This is so important for your safety and for the safety of others. Let's talk about picking the right dome for your hearing aid. We have a bunch of different types, but here's the importance of picking the right one. If you ever heard squeaking or whistling sounds from your device, that's called feedback. Feedback happens when sound leaks from the hearing aid speaker and re-enters to the microphone. If you're experiencing feedback, it might mean your dome doesn't create the proper seal in your ear canal. To fix this, we need to try the different types that are offered in your box, or try sizing up with the dome that actually fits your ear. Any of these things will help correct the feedback issue. Let's understand your unique anatomy. Everyone's ear canals are different, and even your left and right ears may require different domes, whether it's size or style. Your ears are like sisters, not twins. It's perfectly normal to need a different dome on either side. Experiment with sizes and types. We want to find the right dome, and that often involves trial and error. So, I know that can feel frustrating, but we need to find the dome that's best snug for your ear canal. Give it time, wear the domes for a few hours, talk, chew, move around. Try to figure out which dome is actually staying in your ear canal. We want it to stay in your ear canal, but we also don't want discomfort. So, also, we need to remember that there can be temporary feedback when you're touching the devices. If you touch the microphone while getting it into your ear, then you may experience some feedback. But once it's unbothered and in place, we shouldn't hear whistling. Be patient. Finding the right fit takes time, and I know trial and error can be annoying, but it's a part of the process. You got this. Everyone's ears produce wax at a different rate and in varying amounts. When you're younger, earwax is a yellow, sticky consistency, and water exposure, like in the shower, makes your ear a self-cleaning organism, allowing the wax to just come out naturally. As we age, the consistency of the ear wax changes. It becomes darker and harder, and it tends to stick to the sides of the ear canal. When this happens, the ear is no longer a self-cleaning organism, and you can't get the ear wax out naturally. You need to go to an ear, nose, and throat doctor or your primary care doctor for a professional wax removal. If your hearing seems unclear and changing your wax guards isn't helping, it may be time to just have your ears checked out. Hardened, impacted wax can block sound, making it difficult to hear clearly until the wax is removed. It's perfectly normal to need professional ear cleanings every 4 to 6 months, or even once a year, depending on how quickly your ears accumulate wax. This is a very common occurrence, and there's no need to panic. Just see your ENT or your primary doctor. You got this. Everyone accumulates some earwax. It's natural. However, the amount and rate of accumulation varies from person to person. Some individuals may need to change their wax filters about every 2 weeks, while others may only need to change their wax filters every few months. It all depends on how quickly your ears produce wax. So let's open the box and locate your wax filter stick. Your wax filter stick is going to look something like this. There's a side with nothing on it, completely empty, and there's a side with a filter, that little white piece at the end of the stick. Now, I want you to take your hearing device and remove the dome, meaning the little rubber piece at the end. We're gonna take the stick, the side that has absolutely nothing on it, and we're gonna poke it into the device. This is gonna remove the old wax guard from your device. Then we're gonna turn your stick around and put the clean one inside. Once you've done that, this, garbage. You're gonna take your little rubber dome, secure it back on your device, and you're good to go. If you're nervous, I call this the pull test. Just do a little tug. If it's staying in place, you got it on right. One of the first questions I'm always asked is, why do I hear an echo on my own voice? This is extremely normal, especially within the first few days, to feel an echo sensation on your own voice or even the voices of others. Patients have described this as sounding like they're in a tunnel or in a barrel. You need to get used to hearing through microphones and listening while your ears are occluded by the devices. Normally, if you just put your fingers in your ears, you can simulate this perception and really hear your voice in your throat. This is called the occlusion effect. It's the sensation of increased loudness when a patient experiences self-generated sounds, such as talking, chewing, swallowing, anything like that when your ears are covered. This can feel uncomfortable to patients at first, especially those with mild to moderate hearing losses. But you will adapt with time. Wear your hearing aids every day, several times a day, and you will get used to the sound of your own voice. Let's talk about what to expect with your new over-the-counter hearing aids. First, you must have realistic expectations that this will take time to adjust to these devices. You can start at a lower volume for comfort and gradually try to increase your volume. It may take a minimum of 2 weeks to get used to wearing the devices, both physically in your ears and how they sound. You may have to adjust your volume or mode, your dome size, your dome shape. It can feel like trial and error, and I need you to know that that is perfectly normal. You must have realistic expectations that you should perceive improvement, but not perfection. The devices are not a cure, but an aid. The best environments for listening are one-on-one conversations and small groups in quiet environments. You may perceive difficulty understanding speakers that are at a distance or in environments with significant background noise. If you notice that you're asking for less repetition, the TV volume is getting lower, you notice that soft sounds like the birds chirping in the morning is something you're starting to notice every day, then you're noticing improvement. I know that soft ambient sounds will seem louder. With time, the level of these sounds will become your new normal. With consistent use, meaning several hours a day, you will adjust to the sound of the devices. I know your own voice feels funny, and I know you may be perceiving an echo on your own voice or the voices of others. You're not used to hearing through microphones, but you will get used to it with time. There's several things you can do at home to make this experience better. Try reading aloud to adjust to the sound of your own voice. The more you interact and practice listening to your own voice and listening to others, the quicker you're going to adjust to the sound of your hearing devices. Let's talk about communication strategies to improve your hearing journey. First, try to be in good lighting and face the speaker. Your brain is also using the visual cue of lip reading to understand the message. Even those without hearing loss benefit from a visual cue. This is especially helpful for those with hearing loss. Think about how everyone likes subtitles. Next, avoid sitting with the sound source behind you or near you. Try to avoid sitting near the band playing or the music or the bustling kitchen of a restaurant. Try to avoid those really loud settings being directly behind you or near you. Next, advocate for yourself. You have a hearing loss and still may need people to talk slower or a little louder or to face you. You can always politely inform others what you need to communicate effectively. If you do miss something, it can be useful to ask speakers to rephrase rather than repeat. You got this.